Daniel. I'm here with another video again. This is Messy Space. Welcome again to my video. In the previous video I talked about the indications for a cesarean section, but in that video I emphasized on the fetal causes or fetal indication for a cesarean section. In today's video we are going to talk about the maternal indication for a cesarean section. Why will you perform a cesarean section on a woman? Number one, maternal cause or maternal indication for a cesarean section is previous cesarean section, previous scar. Now, when a woman has undergone a previous cesarean section, it could even be a fibrous surgery. Just a previous scar can be one of the indications. A woman has given birth before through CS. Sometimes when they weigh option, when a woman gives birth through CS the first time, during the next pregnancy, they weigh so many options. They'll check the condition of the mother, the condition of the baby. It must be in good condition, perfect condition. Your BP is fine. You're not diabetic, no diabetes in pregnancy, no hypertension in pregnancy. Your weight, everything is okay. There are many parameters that are going to check to make sure that everything is okay before they will approve you for a VBAC. It must be at least 18 months after you're giving birth to the first one. As if you calculate from the time you give birth through that CS to the next time you put to bed, it should be at least 18 months. And they will approve you for a VBAC. There are parameters for a VBAC. So I'm an advocate for a VBAC. I'm one of the advocates for a VBAC. I advocate for a VBAC if need be. If need be, if everything is fine, why? You can do a trial of labor. And it could, most times it can work out for you and you deliver that baby through the VJ. But if it doesn't work out or the parameters, you don't meet up to the parameters, please go and bring your baby out. And I've never seen a woman that they wrote on her forehead that as she's walking, you are seeing it, vaginal delivery, cesarean section. I've not, if you have seen, please bring that person. Let me see the person. They know the right hand forehead. Some women, if they even pull their clothes, you cannot even detect that they did a surgery. Fine, I know that most women, the problem they complain is the healing process. They'll be like, let me just face that pain, cry down my cry once and push that baby out and forget about the pain. Than the pains of after delivering through a C-section. Some recover fast, some don't recover fast. Fine. In all this, I know that you're going through pains, but it's for a purpose and it's for a good cause. It's not for a bad cause. Another maternal indication for cesarean section is placenta previa. Placenta previa means placenta before baby. Your placenta is lying low. Your placenta, there are class 1, there's class 1, class 2, class 3, and class 4. Class 1 plus placenta previa, it's lying low, but it doesn't cover the cervical os. Class 2 placenta previa is lying low, but covers a little of the cervical os, just a little by the side of the cervical os. And class 3, it covers part of the cervical os, but not totally, doesn't cover it totally. Now the class 4, it covers the entire cervical os. Now where will this baby pass? Even the class 3, I don't advise for a vaginal delivery. Class 3 and class 4, I don't advise for a vaginal delivery. Class 1, there's chances that you can deliver your child vaginally. Class 2, yes, under monitored. In some cases, the placenta previa, sometimes as the pregnancy advances, the placenta tends to go up or shift from the position, so it will not cover the cervical os. That one is a different case. Thank God for you if it happens that way. But if it doesn't, please go and book a cesarean section and bring out your child. Another indication, maternal indication for a cesarean section is placenta abruptio. Placenta abruptio is when the placenta suddenly detaches from the uterus. It suddenly detaches from the uterus. Please, at that point in time, you are even trying to save the mom placenta abruption is a life-threatening condition in pregnancy. It's a life-threatening complication in pregnancy. Please don't take it lightly. So in such a case, you want to now still deliver the baby vaginally, even with placenta abruption? No, now. Another maternal indication for a caesarean section is pelvic abnormality, such as pelvic deformities of the pelvis, like in the case of cephalopelvic disproportion. How will the head pass when the pelvis is abnormal? Or you have an android pelvis, a male type of pelvis. As a woman, because there are women who have an android pelvis. They don't have platypeloid. They don't have gynecoid pelvis. They have an android pelvis. Even anthropoid pelvis is kind of favorable, more favorable than android pelvis. Android pelvis is a mannish type of pelvis, a male type of pelvis. Most times it doesn't favor normal delivery. So these are the things that you should check out. Another maternal indication, if the woman is having what? Preeclampsia. Her BP is skyrocketing with other signs that follows preeclampsia. Proteinuria, there's protein in the urine. There's swellings, swollen face, edema in the legs, in the hands, and even in the belly. Yes, in her belly, the edema. Warning signs of pending eclampsia. And you want to still push the baby. No, it's not advisable. It's advisable to bring out that child via cesarean section. Mother alive, baby alive. Another maternal indication for a cesarean section is if there's an active genital herpes infection. Please, just because yes, bring out that child so that you will not give that baby optemia neonatorum, an infection of the eyes, because now the baby is going to pass through the birth canal and collect all the herpes in your birth canal, and at the end of the day that child will start undergoing treatment. Why you want to suffer that baby? Take the child and bring the child through the cesarean section. That's it. The last maternal indication for a cesarean section, if that woman has any heart disease, any heart or respiratory problem, please do yourself a favor and bring out that child via cesarean section. In addition to that, I'll just put this as an addition to it. Sometimes age, maternal age, consider maternal age. It's very, very important. Maternal age is very, very important. Check that woman's age. If it's somebody that is advanced, please don't put that woman through stress of pushing a child. Don't even do it. Don't even do it. If there's any labor complication, like probably the woman is induced and she had failed induction of labor, it induced her and the induction failed, please kindly approve that they should take you to the theater and bring out your baby alive, and you are going home alive. Or there is prolonged labor. You have labored and labored and labored and labored. Some will labor for days. Why? Why the stress? And the recovery process will even be much painful when you have labored for long than when it's on maternal request. Another one too, when there's a cord prolapse. If there's a cord prolapse, please, the best solution is to bring out that child. Cord prolapse is when the cord flips through, the umbilical cord flips through and stays before the baby's head. That means the baby's head now is pressing on the cord. You're seeing cord before the baby. That's just the simple explanation of a cord prolapse. You do a vaginal examination and you're feeling cord instead of the baby's head. It's already cord prolapse. Because that baby's head now is pressing on that cord. Now, where is the oxygen that will be supplied to that child? And in this case, you're a woman in labor. I tell you that there's cord prolapse. You will still stubbornly say, I can do it. My dear, please Gone are the days of ignorance in this digital time. So these are the indications for a cesarean section. Cesarean section is not a crime, oh, it's not a crime. Do the right thing. Do the right thing. Save your life. At the end of the day, when you go home, you carry your baby. Hey, congratulations. Woe to that person who will come and ask you, did you give birth normal? Or did you give birth under the pot? Did you give birth normal? No, normal delivery. Woe to you who asked that kind of question. Why would you ask a woman that just gave birth the mode of delivery? What are you looking for? What do you want to know? If she tell you the mode of delivery, what do you want to use it for now? What are you taking statistics that you want to look, try to know, investigate? FBI, Inspector General, Opushikwalia, Kobawa fence. Please, enough of all this trash that I come across on social media every day. A woman is pregnant, she will not be pregnant in peace again. Because there are aunties and there are uncles and there are mother-in-laws or father-in-laws that are there to tell the woman how to go through her pregnancy journey. My lecturer back then that taught me labor in my days of midwifery, she will tell you vividly, motherhood, unlike fatherhood, can lead to pie. She was saying it that time. We didn't understand until we entered reality, until we faced the world, until we saw things. Please, a woman who just dropped a child is like a woman who went to the mountaintop and saw God and said that somebody is a woman who went through the midst of fire and came back. To hold that woman will do. Praise her. Buy her push gifts. If you don't want to buy her push gifts, buy her tear gifts. Since she no push her, but they tear her. If you don't want to buy her push gifts, buy her butcher gifts. As if they butchered her. Buy her that one. Buy that her butcher gifts. Tell them that they want to get butcher gifts for you. And I think butcher gifts should even be more bigger than push gifts. Thank you so much for watching up to this point. If you like this kind of videos, comment. If you have experience or stories, life stories, please put down in the comment section for others to learn. We learn by sharing. Thank you so much for watching my video. See you guys in the next video. Bye.